Here on the North Coast, there are people who really want to make a difference. Planners of health services, those who connect with young people and young people themselves, coming together to create a model. It's informed by data, it's informed by real experience, and then to set priorities for change. This has been one of the best communities that we've worked with to pull people together, focus on what needs to be done, make use of new tools, and be deeply, deeply committed to making a really significant change to the lives of young people in this key part of regional Australia.
So we're still working through all of the detail, but we're really keen to advocate very strongly for our region based on the scenarios that have been put through with the models. So we'll be really getting our heads together over the next couple of months now that we have the preliminary results, and looking at a whole range of different advocacy around new service provision. So talking to the federal government and state government about what we think we need for this region, and putting forward for our region in particular that, you know, we can see a really clear trajectory of increased mental health distress for young people in this region. But then if you overlay that with a couple of major disasters, we know that it's going to be even worse. And so that's one of the reasons that we'll be making a case for increased investment. We'll also be looking at what we can do with our existing services and resources as well, because what the model provides is through that dynamic, the dynamic simulation is you can see what happens if you enhance optimisation of current services as well as bringing new services in. So it's not necessarily all about more, it's about getting the right mix of services to get those amazing outcomes that we want to see, which is a decrease in mental health distress and some of those other factors like hospitalisations and suicides attempts, and some of the other things that we see through the data.
I'm hoping that through the model we can work out where it would be best to invest in and work out what the best areas would be to give the better outcomes.
Yeah, we're really going to focus on designing a local plan for young people's mental health and wellbeing, and really want to use the model to inform the sort of activities or interventions that we put in place across the community. And really it is the beginning, so it's going to really help us inform the work that we're going to do as a commissioning organisation moving forward.
What I have heard in workshop 3 is the enthusiasm to use the model for the decision making. Different group of people are trying to find a way to use the model for different decisions they're making, and that's, I think, a good sign, that because they're thinking it is useful and that they're trying to find a way to use the model for their daily decision making.
Services need to work together, both the PHN and the LHD and other government and non-government organisations, to be able to make a difference for children and youth across these districts. I think that all of us working together and hearing and listening openly to young people around what they need is the key takeaway from these types of workshops.
And I hope we can take the model back to my team and look at the effectiveness, and really look at some of the kind of future projections for, you know, education, but not only just the young people education, but education with families. Hoping we'll have a positive impact on our young people, really, and understanding that, you know, budgeting constraints could affect that. So really making sure that we can present information like this model in a way that the people who pass our budgets might think that it's more important to have, you know, some really good outcomes for our young people.
Really specifically to the North Coast, like you know, it's an area that we deal with a lot of natural disasters and stuff. So yeah, having that model there to sort of map the effects of that and, you know, act as a bit of a preventative. Things that I'm most excited about from today.
I've got big hopes. I hope that we get to a point where where the decisions are being made based on a solid evidence base, and that happens really sooner rather than later. I'm really ignited by the fact that we have got follow-up sessions coming after today, and our youth reference group representatives, which we've had 4 come throughout the 3 series, are really keen to continue on the journey.